Muhammad bin Zaini.
And I'm Nur Nabila, and this is Biosphere News.
The top stories. The Negeri Sembilan State Health Department has detected 8 suspected cases of leptospirosis, commonly known as rat fever, at the Ulu Bendul Recreational Centre in Kuala Pilah. This comes after reports of the outbreak surfaced on social media. According to State Health Director Dr. Halina Abdul Rashid, one of the affected individuals has been admitted to the hospital for further treatment, while 7 others receive outpatient care. Investigation began on November 19th when the Seremban District Health Office received 3 cases notification from Sendayan Health Clinic. The cases involved a family from Seremban who developed symptoms such as fever, vomiting, and diarrhea after visiting Ulu Bendul Recreation Centre on November 10th. In the following days, 5 more cases with similar symptoms were reported, all linked to visits to the same recreational centre between November 10th and 16th. Authorities have sent clinical samples to the Sungai Buloh Public Health Laboratory for confirmation. A risk assessment is also underway at the. As a precautionary measure, the Ulu Bendul Recreation Centre has been temporarily closed by local authorities from November 29th to December 15th to allow for thorough cleaning and maintenance. The State Health Director assures the public that the Health Department is closely monitoring the situation and is working with relevant agencies to strengthen prevention and control measures. In the meantime, visitors to recreational areas are urged to prioritize hygiene. Anyone experiencing symptoms after visiting such location is advised to seek immediate medical attention at their nearest healthcare.
Leptospirosis, also known as Wales disease, is caused by the Leptospira bacteria. This infection is zoonotic, meaning it can be transmitted from animals to humans. But how does this transmission happen? Let's take a closer look. The primary cause of leptospirosis is contact with water, soil, or food contaminated with the urine of infected animals. Common carriers include mice, rats, cattle, pigs, and dogs. These animals can carry the bacteria without showing symptoms, making it difficult to detect contamination. Outbreaks often occur in areas with poor sanitation or after natural disasters like floods. When flood water mixes with animal urine, the bacteria can spread rapidly. People who work outdoors, such as farmers, sewer workers, or those in construction, are at higher risk of exposure. Another cause of leptospirosis is direct contact with infected animals. These can happen through handling animals, especially if there are cuts or abrasions on the skin. Even recreational activities like swimming or wading in contaminated water can lead to infection. Once the bacteria enter the body through the skin, eyes, nose, or mouth, they can cause symptoms ranging from mild fever and headaches to severe complications like kidney failure, liver damage, and even death if left untreated. Now, let's go live to Sofiana, who is at the ground at World Health Conference, to bring us the exclusive interview with Dr. Halimatun and Dr. Masha. Over to you, Sofiana.
Thank you, Nabila and Muhammad from Sri Pentas. A study in Selangor found that leptospirosis patients commonly experience fever, headache, and muscle pain, making early detection challenging. So what are the key symptoms to watch out for? This disease progresses in 2 main phases, each with different symptoms. First, the acute phase, which lasts about 5 to 7 days. During this stage, patients may experience fever and chills, severe headache, nausea, vomiting, and red eyes without discharge. Next, the immune phase, where complications may arise. This is when the infection becomes more severe, leading to jaundice, kidney issues, meningitis, bleeding tendencies, including skin rashes, or in severe cases, pulmonary hemorrhage. So, how is leptospirosis treated? To explain more, we turn to Dr. Halimatun. Doctor, what are the treatment options available for leptospirosis patients? Thank you, Ms. Sofiana. So when the patient was diagnosed with leptospirosis, we as a doctor might prescribe them two types of antibiotic, which is penicillin and deoxycycline. So the function of these two antibiotics was to inhibit the spread and growth of the infection in the patient body. However, in more severe cases, like when the infection affecting the patient vital organ, hospitalization may be necessary, which means that the patient will be stay at the hospital for some times and receive medical supervision from the doctors. For example, the patient will receive intravenous antibiotic, which is IV antibiotic. So the function of this IV antibiotic was to enhance the absorption of the two antibiotics that we were given earlier. However, if it keep worsening, the patient will facing the life-threatening complication. So we as a doctor might giving them additional medical support, which is ventilator and dialysis to assist with their breathing, the proper medication, and for the analysis, we can enhance the full recovery of the patient. Thank you, doctor.
And of course, prevention is always better than cure.
Dr. Marsha, what precautions should the public take in order to avoid this disease?
Alright, so to protect yourself and your loved ones from this disease, firstly, you need to avoid contact with potentially contaminated water or soil, especially after heavy rains and flooding. If wading through flood water is unavoidable, make sure to wear protective clothing like boots or gloves. Number 2, keep your surroundings clean. Make sure to dispose of garbage properly and eliminate potential rat-breeding sites around your home. Other than that, you should also store food and water in rat-proof containers to prevent contaminations. Moreover, you should also practice good hygiene. Wash your hands thoroughly with soap and clean water, especially after handling animals, soils, and flood water. Other than that, you should also, if you have cuts, abrasions, or open wounds, keep them covered with waterproof dressings to prevent exposure. Lastly, make sure your pets are vaccinated. Dogs, for example, can carry and spread this disease, so keeping their vaccinations up to date is very essential.
That's a crucial advice, doctor. To everyone watching, if you have any other symptoms, especially after exposure to floodwaters or contaminated area, please seek medical attention immediately. Back to you at Sri Pentas.
Thank you, Sofiana. Leptospirosis is a preventable disease, and awareness is the first step towards protection. Stay informed to stay safe. My name is Nur Nabila, signing off from Biosphere News. See you next time, and Assalamualaikum.